Hello, I'm Dr. Paul Lawrence. Today I'd like to demonstrate for you this injection of the dorsum of the hand using fillers, different fillers, to volumize the hand. As we get older, we lose the volume of the hand, the veins become more prominent, and the visibility of the tendons is much more apparent. Utilizing volumizing fillers, and whether it's Restylane or hyaluronic acid, calcium hydroxyapatite, Sculptra, or fat, you can mask those and rejuvenate the hands. Today we have a patient of ours. Maria is in her late 40s, but may I see the other hand, Maria, please? And you can see in the hand, so she's really a grade 3 on the Merz scale of the hand, where you can see prominence of the veins. Also, the tendons are becoming apparent, and you can see that on both hands. And what I will be doing today is just to volumize it using calcium hydroxyapatite. What I use is a diluted solution of calcium hydroxyapatite. I also inject it using a blunt cannula. Now, this is an off-label use because the indication for injection of the dorsum of the hand, which was just cleared last year by the FDA, involves needle injection. Yet I, in my opinion, believe that it's a much less traumatic application using a cannula. And what we use is a 22-gauge cannula that's 5 centimeters long. And what I do is I just mark the hand. And you can see that this is really a very simple application. Here's just a little pinch, Maria. We, of course, have cleansed the hand to make sure that there is no contaminants on the surface of the hand. What I'll be injecting is, as I mentioned, calcium hydroxyapatite. I dilute it. This is an off-label indication, again, using 1.5 cc's of calcium hydroxyapatite mixed in with 1 cc of 1% lidocaine. And I use an adapter that enables me to mix the product thoroughly, and usually it's about 10 to 15 times back and forth. We have a very homogeneous distribution of the calcium hydroxyapatite particles, and you can see that it's just very uniformly distributed. Using a 21-gauge needle, we'll make a little puncture on the back of the hand that will allow me to introduce the cannula. You okay? And typically this is a very painless procedure. And here all we're doing is just connecting the cannula to the syringe. Just lift up your hand. And you can see that the cannula goes right underneath really the dermis, and the injection is between the superficial fascia and the dermis, utilizing these proximally based incision sites. Allows me to gently introduce the cannula, and you can see that there's no injury to the veins. This is a very atraumatic application of the injectate, and here you can see a distribution in the first space. I like to introduce it in an as even a way as possible. So the total volume that I'm injecting this morning for Maria per hand is 2.5 cc's. But of course, the volume of calcium hydroxyapatite is 1.5 cc's. Using the blunt cannula really allows me to very gently displace the veins and stay in that really subdermal space, which of course is the right placement. If you're too deep with the placement, you can interfere with the deep fascia, which encases the tendons, and of course we don't want to do that. But you can see how gently the cannula just displaces the veins, and there's no trauma, there is no black and blue. And typically patients who undergo this procedure have very little, if any, ecchymosis or black and blue. There is some swelling that persists for 48 hours or so. We instruct the patients to take it easy, not to exercise, for a couple of days. And just, Maria, I just want to show you that there is a pretty even distribution right now. And I think one of the most important parts, make a fist, please, is to massage the material thoroughly. Could I have a little bit of Aquaphor, please? And you can see how, provided that you're in the right space with the filler, you can distribute the material very evenly. And you can see again that it's a very even distribution. Key points of injecting the dorsum of the hand to rejuvenate it is, one, being as atraumatic as possible, two, being in the right space. And again, the cannula glides in that space. In my opinion, and again, this is an off-label use, is the cannula is less traumatic to the soft tissue. Therefore, there is less swelling and less bruising post-injection. Straighten out your hand, please. And in a minute, I'll show you the difference between the injected hand versus the non-injected hand. Also, the beauty of using calcium hydroxyapatite, you saw that it's a white product. Even though it's mixed, it maintains its color. Therefore, there is really no chance of the Tyndall effect. And it's perfectly suited for using it to enhance the dorsum of the hand. Also, calcium hydroxyapatite is the only product that's right now FDA cleared for that use as of February of 2015. And you can see that the volumization of the hand is apparent. May I see the other hand? And you can see the tremendous difference, how prominent the veins are on the right hand versus the left hand.